Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today in the following order are the Honourable Blaine Higgs, Premier of New Brunswick, and Dr. Jennifer Russell, the province's Chief Medical Officer of Health. Les porte-paroles aujourd'hui sont dans l'ordre suivant. L'Honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick, et le médecin hygiéniste en chef, la Dr. Jennifer Russell. Premier Higgs.
Good afternoon. Bonjour. Today we have reached a terrible milestone as we have lost 2 more people to COVID-19 and have surpassed 100 deaths as a result of this virus. These are not statistics. These are people with family and friends. As your Premier, I feel a loss with each death that we announce. I am provided enough information to know the circumstances surrounding their deaths and that each one of them are much more than a statistic. We have had young pregnant mothers fighting for their lives. We have lost young men, fathers, who are strong and healthy. And while you may hear about the death of an elderly person and perhaps think at least they live a long and full life, the fact is no one would want their loved one to die this way. With every death we have announced, there are loved ones left behind who are grieving their loss. Today, sadly, 2 more families are grieving once again. I encourage all New Brunswickers to take a moment to think about the people we have lost due to this virus and those mourning them. J'invite tous les gens de New Brunswick à prendre un moment pour penser aux personnes qui sont décédées à raison de ces virus et à celles qui pleurent leur départ. I have seen and heard the criticism and the questions. Did we underestimate the Delta variant? Did we ease restrictions too soon? Were we overly confident that more New Brunswickers would get vaccinated? I know that many of you are frustrated and in some cases angry that we are still living with COVID. And I understand this because I too feel the same way. I thought we could move past COVID and embrace a new normal with family and friends and the lifestyle that New Brunswick provides. Hate is a very strong word, but I hate that we are back here after all we have done and worked so hard to combat COVID. And it is extremely difficult to come to terms with the fact that COVID is here to stay. Je déteste que nous soyons de retour ici, après que tout le monde a travaillé très fort pour lutter contre le COVID-19. Est-il extrêmement difficile d'accepter le fait que le COVID-19 est là pour rester? I've been your Premier for 3 years now, and for almost 2 years, COVID has consumed our mandate. This was certainly not anything that any of us could ever imagine. While I understand the frustration people are feeling, I would ask you to think about this. We have been working with a team for the past 2 years that have put in countless hours a day and countless hours at night to keep our province safe. And while we may have made mistakes along the way, this team has got us this far, and this team will continue to fight COVID till we get beyond and learn to live with it in a lifestyle that's acceptable. What I am extremely sad about is that all of a sudden people are angry, but I understand it because I'm equally angry. But they need someone to take their anger out on. And no matter how hard anyone works, And no matter how hard we are fighting to fight off the latest wave, we all can become demoralized. We are all COVID tired. But the individual comments do matter. They hurt. They hurt my team. They hurt myself. They hurt my family. They hurt our ability to get up and carry on as we must to fight this fourth wave. While I accept this comes with a job as Premier, I am very concerned that those comments will continue to demoralize the very team that we are counting on to get us through this. J'accepte que cela vient avec le poste de Premier ministre, mais je crains beaucoup que ces commentaires puissent démoraliser l'excellente équipe sur laquelle nous pouvons compter pour nous sortir de cette situation. I want New Brunswickers to know we are doing the best we can with the information that we have at any given point in time. Public Health, Cabinet, COVID Cabinet, together make decisions with the ultimate goal of protecting our healthcare system and keeping New Brunswickers as safe as possible. While at the same time, we are recognizing that COVID is going to be an ongoing reality for the foreseeable future. We must find a way to live our lives with the reality of COVID. We need to keep our economy going. We need to stay connected to friends and family and find ways to safely do the activities that make life enjoyable. This is crucial for the well-being of our residents. Nous devons trouver une façon de vivre avec la réalité de la COVID. Nous devons continuer à faire rouler l'économie. Nous devons demeurer en contact avec nos amis et notre famille. Et nous devons trouver des façons sécuritaires de le faire, des activités qui rendent à la vie agréable. C'est essentiel pour le bien-être de notre population. I know you are frustrated that the markers of success continue to move and our directives change. But we are all learning that COVID-19 continues to change as well. During the early waves, the people we lost were elderly or had underlying conditions. Now in the fourth wave, we are seeing not only the sick or elderly succumb to this virus, we are now also losing younger people, healthier people. The Delta variant has proven to be a fierce enemy. We are learning that vaccination is your best protection against serious illness and death, but new information is emerging all of the time, and it is now clear vaccination coupled with other public health measures are our best chance for success. If we look at our case numbers, there is hope, because we are starting to see a trend downward. However, we will continue to have new cases at a rate that continues to challenge our healthcare system. Si nous regardons le nombre de cas, nous réalisons qu'il y a de l'espoir parce que la tendance est à la baisse. Cependant, il y a encore de nouveaux cas et hauts taux qui menacent notre système de santé. Approximately 6% of cases will be hospitalized. This is a threat to our hospital system that we need to address. We can turn this around, but we do need every New Brunswicker to support and trust and take the steps needed to beat this virus back, and as we have done so many times before. As a whole, New Brunswickers have done what we've asked them every single time. You have looked out for your neighbors, your family, and friends. You have taken steps to protect yourselves, and by doing so, have protected others. We must continue to work together if we hope to overcome the challenges we are facing and get past this. On a government level, we are doing just that. Nous devrons continuer à travailler ensemble pour surmonter les défis qui se présentent à nous et pour traverser cette situation. Et ce qui concerne le gouvernement, c'est ce que nous faisons. COVID cabinet, with the opposition leaders, is working well again. We are working together once again and addressing the challenges. I want to thank Roger Melanson, David Kuhn, and Chris Austin for their participation, as well as my own caucus colleagues. We all continue to work with public health to find a way forward for our province. I know there are times politically we may not agree, but I also know we all want what is best for our province, to keep us safe and ensure we have a healthcare system ready and available when any New Brunswicker needs it. Je sais que parfois, nous ne sommes pas d'accord sur le plan politique, mais je sais également que nous voulons tout ce qu'il y a de mieux pour notre province. Nous voulons assurer la sécurité de la population et nous voulons que notre système de santé soit prêt et disponible lorsque les gens de New Brunswick en ont besoin. When we introduced the circuit breaker measures that took effect on October 8th, our goal was to reduce the spread of the Delta variant in communities that were identified as being at the highest risk. Since that time, the number of new and active cases have moved in the right direction, but they are still not where we need them to be for us to be comfortable with ending the circuit breaker. That is why, on the advice of Public Health at COVID Cabinet, all opposition leaders in Cabinet agreed to extend the current circuit breaker measures for at least 7 days. The areas that will be impacted are Zone 1, the Moncton region, as far north and including Saint-Anne-de-Cant, and including Havelock in Zone 2, the northern portion of Zone 3 from and including Deerville and Florenceville, Bristol, and all of Zone 4. As well, the circuit breaker measures will be extended to include all of Zone 5, the Campbellton region. The circuit breaker in Zone 5 will begin Friday at 6 p.m. and last for at least 14 days. Dr. Russell will further explain why we feel these steps are necessary, but I can tell you because the Delta variant is different from anything that we have experienced thus far, and therefore we need to treat it differently. I know that this news is difficult for those living in circuit breaker areas. You have worked hard. We recognize and we thank you for doing so. You are making a difference. The numbers are slowly getting better, but we still have those areas of significant risk. Je sais que c'est une nouvelle difficile à accepter pour les gens qui demeurent dans ces régions. Vous avez travaillé fort. Nous le savons et nous vous remercions pour vos efforts. Vous contribuez à changer les choses, puisque les chiffres s'améliorent lentement. There is hope, and whether you feel it or not, much of the power to change things for the better is in all our collective hands. We currently have 83.1% of our populations fully vaccinated, and 91.9% have at least one dose of the COVID-19 vaccine. And I know our target is now 90% because we're seeing it is necessary to a higher degree of vaccinations in order to have that herd immunity. So we're asking those individuals that have gotten your one dose to please book and schedule your second dose. Let's get to that 90% figure. It is well within our reach, and the quicker we do so, the quicker our numbers will decline. I cannot stress enough that getting vaccinated and following the measures in place where you are living is crucial, not only to your health, but to the success of our province. We need this circuit breaker to work, to reduce the number of hospitalizations, prevent the virus from spreading further, and to ease the strain on our healthcare system. I know you have a lot of questions about what is happening in our hospitals. That is why I've requested that the CEOs of Vitality and Horizon Health Networks join Health Minister Dorothy Shepherd for a news conference tomorrow so that they can answer your questions directly. They are on the front lines and can better explain what is happening at hospitals across our province. We need our hospitals to be in a position to not only to be able to help those with COVID-19, but also be there for those with other health issues. Ils sont aux premières lignes et ils peuvent mieux expliquer ce qui se passe dans les hôpitaux partout dans la province. Nous avons besoin que nos hôpitaux soient une mesure d'aider les personnes atteintes de la COVID-19, mais aussi d'être disponibles pour les gens qui ont d'autres problèmes de santé. The Delta variant is having a ripple effect that is impacting far more than care for COVID-19 patients. Over the past several months, New Brunswick has been working with the Government of Canada and other provinces and territories to develop a standardized Canadian proof of vaccination. The standardized proof of vaccination will facilitate international travel and can be used in each jurisdiction across Canada. The downloadable proof can be accessed on any device and can also be printed. New Brunswick has met all of its milestones in this development work and with other provinces and territories, and we are on track to deliver our QR code proof of vaccination credentials in mid-November. The mandatory order is being renewed for another 2 weeks, with one important addition. We have heard from businesses that there have been instances where an employee has tested positive on a rapid test and has not gone for further testing to confirm the results. This is not acceptable. Rapid tests are a tool to help us catch cases of COVID-19 early, but they only work if used properly and if people follow up on a positive result quickly. To further support businesses and their efforts to keep their employees, clients, and our province safe, it will now be a finable offence if you do not go for a PCR confirmatory test after receiving a positive result on a rapid test. Information on how this will be enforced will be shared with employers. I want to thank the many businesses across this province who continue to step up by participating in regular testing and encouraging their employees to get vaccinated. This is extra work, but you are leading by example and your efforts are making a difference. Je veux remercier les nombreuses entreprises de partout dans la province qui poursuivent leurs efforts en participant à des dépistages réguliers et en encourageant leurs employés à se faire vacciner. C'est de travail supplémentaire, mais vous donnez l'exemple et vos efforts permettent d'améliorer la situation. And they are helping to keep our province open and moving forward. Today is indeed a tough day for our province, and there's no getting around that. It is a tough day for me personally. I recall the first deaths we had at the beginning of the pandemic, and many of you will recall how upset I was because our target was 0 deaths. And obviously earlier in the summer, we felt we were on our way at least to control the current level of deaths that we'd experienced to that point. And now we find ourselves at a milestone that we hope never to achieve. But during hard times, we are presented with the opportunity to rise and show how strong and resilient we truly are as a province. And we can all find fault in what we do differently. And there are many things that each of us would look in hindsight and say, if only. Well, right now, we're dealing with the reality of what we have learned to date, with the reality of the Delta variant, and the reality that there is a real possibility that we can achieve at least 90% of a threshold that could meet our herd immunity. We want everyone to be vaccinated, but we are realizing that is likely impossible to achieve. So let's focus on the ones that want to be part of the success story. Let's focus on those that will help us to reach this milestone of 90+%. Let's focus on us getting to live a life with COVID that is livable here in New Brunswick. I too want to get back to normal, Normal will be defined differently, but we will be able to have a life after COVID. We can't do any of this without recognizing the work, and I sincerely want to thank our frontline healthcare workers for all they're doing right now, for all they've done through the entire pandemic, and what we continue to do with COVID as part of our daily routine. The dedication that they are showing to their profession and to the people of this province are appreciated more than words can ever say. I also want to thank our public servants, those in health, public safety, education, social development, Service New Brunswick, and those in communications. Thank you for all that you do each and every day as we mitigate the effects of COVID-19 and push through this fourth wave. To each and every New Brunswicker, I implore you, this is not the time to give up. We in New Brunswick do not give up. We have been on a roll here. We continue to be on a roll. People are recognizing our province for just how great it can be. And I do not want to lose that momentum. And I know it's easy to criticize, and I know it's easy to get into a situation where everything is negative. Well, I refuse to accept that. Just as in the early days, years ago, I refused to accept commentary from outside our province that reflected poorly on New Brunswick. Well, we have seen of many months over the last several months, of the great accolades we are seeing as a province, that people are recognizing how good we can be, something we've all known all along. So let's not let this COVID thing disrupt our potential for being the province that we know we can be. We must continue to have hope. We must continue to have determination. We must continue to have resolve. And we must continue to support each other to get through this, not find ways to tear each other down. Merci pour tout ce que faites chaque jour, alors que nous attendons les répercussions de la COVID-19 et que nous traversons cette quatrième vague. Et à tous les gens de Nouveau-Brunswick, je vous implore de ne pas abandonner. Ce n'est pas le moment. Nous devrons avoir de l'espoir et de la détermination alors que nous continuerons d'avancer ensemble. We have seen the devastating impact the Delta variant is having, but we continue to perform at a standard that certainly is unenviable in many parts of our country and in many parts of the world. And that is why we will continue to focus on the things we can control. We will continue to change as we must to keep this moving in a direction that reduces cases and reduces the risk. The steps we can take every day to keep ourselves and our loved ones safe is very important. We truly are stronger together. And we indeed, together, if we maintain our commitment, we will beat this. We will once again get better with COVID because life at COVID will be under control. Merci. Thank you.
Thank you, Mr. Premier, for those very heartfelt words. I think people needed to hear that, and it was quite encouraging. Un gros merci pour les mots de motivation. And I wanted to just follow up on a few of those items before I start, just with an anecdote about what it means to encourage people and focus on the positive, focus on the good. When I was a teenager, my mom would always give me a few chores to do after school, and I would usually get most of them done, but I'd usually forget one or two. She'd give me 5, and I might do 3 on a good day. And And she would call and say, did you do all the things I asked you to do? And I'd say, well, I did this and this. Well, what about these other things? But I did the 3 things. And so I want to just mention that for all New Brunswickers who've been doing so much hard work and doing as much as they possibly can to follow public health guidance and all the hard work and all the sacrifices, to really acknowledge that hard work. And that is what has gotten us this far in terms of how we've been able to manage. Je voulais juste dire une petite histoire. Quand que j'étais jeune, quand j'étais ado, ma mère me donnerait des petites choses à faire après l'école. Des fois que je les oubliais une couple de choses et elle me disait, oh, t'as oublié ça, mais j'ai dit, ah, il faudrait que j'ai réussi à ces choses ici. Alors, il y a beaucoup de personnes qui ont travaillé tellement fort depuis les dernières 18 mois. Puis c'est vraiment important de n'oublier pas que, oui, on est dans une situation maintenant qu'on a des défis, mais le même travail qu'on a tout fait ensemble, comme collectivement, c'est encore important de continuer. Et je vous remercie tous pour le travail que vous avez fait jusqu'à maintenant. Bon après-midi à toutes et à tous. Good afternoon, everyone. Comme le Premier ministre Higgs, je tiens à exprimer mes condoléances aujourd'hui pour toutes les personnes que nous avons perdues à cause de la COVID-19 dans la province depuis le début de la pandémie. Nous sommes tous tristes devant une telle perte et le deuil qui vivent les familles et les proches des personnes décédées. We all share in the sadness of this loss and in the grief being experienced by the families and loved ones of the deceased. My sincerest and most heartfelt condolences go out to these families in their time of mourning. And I hope there will be some comfort in knowing that every New Brunswicker grieves with you. La 4e vague de la pandémie de COVID-19 continue. Même si nous voyons des signes du début d'une diminution du nombre de cas ici et ailleurs au Canada, nous ne pouvons pas nous permettre de baisser notre garde. Nous devons tous rester vigilants, en particulier dans les régions ayant les taux d'infection les plus élevés. Les mesures coupe-circuit établies il y a 2 semaines dans les régions de Moncton, du Madawaska et dans la vallée du Haut-Saint-Jean ont stabilisé le nombre d'hospitalisations. The 4th wave of the COVID-19 pandemic continues. And while we are seeing some signs that it may be starting to recede here and elsewhere in Canada, we can't afford to let our guard down. We all must remain vigilant, particularly those living in the areas with the highest rates of infection. And I know this is difficult. And the circuit breaker measures that we put into place 2 weeks ago for Moncton, Madawaska, and Upper St. John River Valley regions have stabilized the number of hospitalizations, and this is good news. The first slide I'm going to show you, I believe they're showing that right now, the slide, yep. So the first slide is the epidemiological curve, the epi curve, and this shows the daily new cases from August 1st to October 20th. And you can also see on this slide that when new regulations were implemented, including the reintroduction of the state of emergency and the circuit breaker, you can see that first line. The black line is the 7-day rolling average of new cases reported each day. And so this shows the effectiveness of the measures that we have taken, particularly the limiting of close contacts, as that is what was driving the transmission. So we are now headed in the right direction, but we definitely need to ensure that this trend continues. So that's the end of that slide. Voilà pourquoi Santé publique a recommandé que ces mesures demeurent en place pendant au moins 7 autres jours et soient élargies pour englober la région de Hamilton pendant au moins 14 jours à partir d'aujourd'hui. Si nous devions éliminer ces mesures maintenant, avant d'avoir l'assurance que la tendance à la baisse du nombre de cas et d'hospitalisations soit confirmée, nous ne ferions que prolonger ces éclosions. This is why Public Health has recommended that these measures remain in place for at least another 7 days and be extended to include the Hamilton region for at least 14 days from today. If we were to remove these measures now, before we can be certain that the downward trend in cases and hospitalizations is confirmed, we would only be prolonging these outbreaks. And I want to thank everyone in the hot zone areas for their diligence and their patience as we work to reduce the impact of this virus on our province. I know it is a sacrifice, particularly in limiting your close contacts with people outside your immediate household. But this is precisely what is helping us succeed right now, and please keep doing this. It is working. Aujourd'hui, Santé publique a confirmé 67 nouveaux cas de COVID-19 au Nouveau-Brunswick. 63 rétablissements sont rapportés aujourd'hui et il y a maintenant 762 cas actifs dans la province. Today, Public Health has confirmed 67 new cases of COVID-19 in New Brunswick. With 63 recoveries reported today, there are now 762 active cases across the province. This is a decrease from the 100-plus daily cases and the peak of 1,000-plus active cases we were seeing, but we are not out of the woods yet. The fastest and surest way out of this fourth wave is the combination of increasing our number of vaccinations among New Brunswickers in terms of having two doses of the vaccine, and then having also everyone follow public health guidance, particularly in limiting your close contacts. Vaccination is an important tool and the most effective, but with the Delta variant, other tools must also be used. Jusqu'à présent, 82% des Néo-Brunswickois ont reçu la dose complète d'un vaccin contre la COVID-19. Presque 92% d'entre nous sont au moins partiellement vaccinés. C'est une réalisation importante, mais il en faut plus. To date, 82% of New Brunswickers have received the full dose of a COVID-19 vaccine. Almost 92% of us are at least partially vaccinated, and that is a significant achievement, but we are needing to do more. Every New Brunswicker who is not fully vaccinated is at significantly greater risk of severe illness, hospitalization, and death due to COVID-19. If you are in a position of leadership, or you're in a community setting where you have people that need answers to their questions, need their concerns reassured, need more data information, please reach out to those people, because they do need someone to listen to their concerns and have their questions answered. I am showing another slide now about the comparison of the vaccinated versus the unvaccinated, the impacts, how COVID-19 is impacting the unvaccinated versus the vaccinated population. So, these bars measure the incidence of COVID-19 and its health impacts based on the number of cases per 100,000 people in each group. So this is an important distinction, because far more New Brunswickers are vaccinated than unvaccinated, and that is very good. So it clearly shows that if you are not vaccinated against COVID-19, the odds are that you will have more severe outcomes, there's no question. So we have seen that unvaccinated people contract COVID-19 at a rate that is 10 times greater than vaccinated, and they're hospitalized at a rate that's 9 times greater, and are put into intensive care at a rate 22 times greater, and die from the effects of this virus at a rate 4 times greater than those who are fully vaccinated. And this is simply too great a risk to take. And I did see the story about my colleague in Saskatchewan yesterday, and he was quite distressed about the situation there and the fact that so many young people are going into ICU and dying of a vaccine-preventable disease. So my heart goes out to him and all people living in Saskatchewan right now and what they're living. We definitely need to make sure that we're reducing those risks here. Si vous n'êtes pas encore pleinement vacciné, je vous exhorte à vous faire vacciner aussitôt que possible. 55 Néo-Brunswickois sont maintenant hospitalisés avec la COVID-19, dont 16 aux soins intensifs. 27 des patients hospitalisés sont pleinement vaccinés. Toutefois, la plupart de ces cas n'avaient pas le COVID-19 lors de leur admission. There are now 55 New Brunswickers in hospital with COVID-19, including 16 in an ICU ward. 23 of these hospital patients are fully vaccinated. However, most of those cases did not have COVID-19 when they were admitted. They contracted the virus after they entered the hospital due to the ongoing outbreaks at the Moncton Hospital and the Campbellton Regional Hospital. These fully vaccinated patients are generally experiencing mild symptoms, but they still must be treated as COVID-19 patients requiring additional care and protective measures. This is adding to the strain on our already stressed healthcare system. Infections are also occurring among the broader vaccinated population, and these breakthrough cases are not unique to New Brunswick, and they are expected. As our vaccination rate increases, we expect that between 1/4 and 1/2 of new infections will be in fully vaccinated individuals. However, we expect that the majority of those people will be protected by their vaccination with respect to reducing severe outcomes, reducing hospitalization, ICU admission, and death. Pendant que nos taux de vaccination augmenteront, nous prévoyons qu'entre le quart et la moitié des nouvelles infections surviendront chez les personnes pleinement vaccinées. The vaccine is not perfect, but it is very effective at preventing serious illness, hospitalization, and death due to COVID-19. The increasing number of breakthrough cases makes it more important than ever to protect our most vulnerable people, as well as the healthcare professionals who work to protect them. We have provided additional vaccinations for nursing home residents and New Brunswickers with compromised immune systems. À partir de la semaine prochaine, nous offrirons des doses de rappel aux travailleurs dans les secteurs des soins de la santé et des soins de longue durée. Au cours des prochaines semaines, nous offrirons une dose de rappel aux autres groupes prioritaires pour protéger les personnes vulnérables. Beginning next week, we will offer booster shots to workers in the healthcare and long-term care sectors. In the coming weeks, we will provide booster shots to other priority groups to protect the vulnerable. We have all been at this for a very long time now, 18 months since our first case of COVID-19, and everyone is tired. Everyone wishes this pandemic was over. And the government measures that are in place right now are to slow the fourth wave, and we are seeing that these measures are starting to bear fruit. But these measures are only as effective as the decisions that each of us as individuals make to follow this guidance. And again, I thank all of you who have been tirelessly following public health advice throughout the entire pandemic. When you wear a mask while in a public place, you are helping to slow the spread of this disease. When you wash your hands, when you stay home when you are not feeling well, this is very important. I actually came across an acquaintance this week and I said, "How are you? How are you doing?" And they said, "Oh, I have a cold." And I said, "Oh, well, maybe you should get tested for COVID because there are a lot of cases around." They said, "Oh, no, it's just a cold." No, you should really go get tested for COVID and you should really wear a mask. And that's what we need everybody to do, to take that individual responsibility to keep making sure that we're not increasing transmission of COVID right now. So please seek testing when you have symptoms. Each of these individual actions are what is making a difference right now. Your actions matter. They can and will save lives. None of us is alone in this struggle, though it may feel that way for many of us. And when we work together and look out for one another, we can achieve great results. And I just wanted to mention that anecdote at the beginning. I wanted to comment about my mom and dad. They actually usually watch these press conferences every time we have them, but they're actually en route to Ontario right now for my dad's brother's funeral, and I'll be joining them there tomorrow. So thank you very much.
Thank you, Premier. Dr. Russell, merci beaucoup, Monsieur Premier Ministre. Dr. Russell. We'll now proceed to question period with members of the media. Each reporter will have one question, and you have the right to pose your question in the official language of your choice. Nous allons maintenant procéder aux périodes de questions avec les membres des médias. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question. Today we're going to start with Laura Brown from CTV. Laura? As we wait for you, we're going to go to Travis Fortnum of Global TV.
Hey there, can you hear me?
Yes, thank you, Mr. Fortnum.
Cool. My question is for Dr. Russell. Dr. Russell, you mentioned the expanding third dose or booster shot program here. Wondering if you could shed some light on what's guiding that rollout, considering NACI hasn't yet reached the same point or points in its guidance on third doses.
Yep. Hi, Travis. So throughout the pandemic, NACI, even before the pandemic, NACI has always been where we turn to for our expert advice on immunizations. There's no question, and we have constant presentations and collaboration with them through our Special Advisory Committee, which is made up of all the Chief Medical Officers of Health across the country and Public Health Agency of Canada. But at every juncture during the pandemic, we have always, as each jurisdiction follows their own epidemiology and their own risks. Currently, I believe the province of Manitoba is in a similar situation whereby we are dealing with outbreaks, as you know, in many nursing homes, et cetera, and the vulnerable populations that require those booster doses sooner rather than later with respect to waning immunity, the fact that the people that had their first dose in December and January, the interval between those doses was 21 or 28 days, which has been shown to be less effective as a longer interval. So again, we base our decisions on our distinct population, our epidemiology, and definitely, as you know, on the East Coast, we have a much older population. So that does change things for us. And we're definitely would always respect what NACI is recommending. At this time, again, we're trying to protect New Brunswickers as best we can based on, again, our situation in this jurisdiction.
Thank you, Ms. Fortnum. Thank you, Dr. Russell. Laura Brown.
Can you hear me now?
Yes, thank you.
Sorry about that. I was talking to myself, apparently. Premier Higgs, I'm wondering, you may have seen calls to protest vaccine passes and mandates coming up, including a store event that appears to be planned for several Walmarts next weekend. I'm wondering your thoughts on this, and will there be repercussions or safety officials on site, et cetera?
Ms. Brown, can you repeat your first portion of your question? And if
Yes.
you could go a little closer to your microphone, that would be super.
I hope you can hear this time. Premier Higgs, you may have seen the calls to protest vaccine passes and mandates, including a store event that appears to be planned for several Walmarts next weekend. I'm wondering your thoughts on this, and will there be any repercussions or safety officials on site?
So I'm not familiar with the details of the event at this point, but I assure you that our public safety officials will have monitored what this is scheduled to be and will be present because these activities, particularly if they're in a circuit breaker zone at this point, we will be enforcing the rules that we've put in place, and we will be present.
Thank you, Premier. Thank you, Ms. Brown. Natalie Sturgeon, Global TV.
Can you hear me?
Yes.
Okay. This question is for either Premier Higgs or Dr. Russell. Long-term care is currently in a crisis. People in the sector are saying residents are dying in record numbers, at least from what we know. There has been a change in policy in the definition of an outbreak, despite the increased transmission of the Delta variant, which we knew was present in the province. How do you explain not mounting a greater response to protect against the situation now facing long-term care? And why wasn't there transparency about these outbreaks early on, as advocates have called for?
So thanks for your question. With respect to management of outbreaks in the province for all nursing homes, we've been receiving the information on a very rapid basis. My understanding is every 5 hours or so, the information gets updated, and then we take that and add it to our list of places that have outbreaks. And in terms of the resources and staffing, we have our prompt teams that are deployed at most of those places that require that extra support. So I can give you the list right now of what we have in terms of outbreaks. My understanding is we have 11 outbreak sites. One of them is the Drew Nursing Home, Woodstone Residence, House of Nazareth, Residence de Marais, Manoir Saint-Jean-Baptiste, The Crossing, although I believe that one might be declared over soon, Maison du Bonheur in Edmundston, Foyer La Renaissance in Saint-Anne-de-Madawaska, Agence Résidentielle Restigouche, Dalhousie Nursing Home, Lausier Hall in Miramichi in Zone 7. So those are the ones that I have right now, and I believe there's one set of tests that we're waiting to come back to declare another one over, which I believe might be Drew. Yeah, tomorrow.
Thank you. Ailish Bonang, CTV.
Hi, folks. Can you hear me?
Yes, thank you.
Okay, great. My question is also for either Premier Higgs or Dr. Russell. So tomorrow marks the final day for provincial employees who fall under the sectors that are required to be fully vaccinated by the 19th of November deadline. They have to get their first dose of a COVID vaccine by tomorrow so that they make it under that deadline with the 28-day period in between. I'm hearing that there are quite a few employees who will not make that deadline, and I'm just wondering, is the plan still to send those people home on unpaid leave given the current labor crisis across the province? And if so, what is the province doing to prepare for the loss of those workers, and specifically in the healthcare sector?
So we are monitoring that very closely, and we have seen a significant uptake in the vaccination levels, which is encouraging. It is still a challenge, however. And we are working with the health authorities and the CEOs because it's particularly a concern, as you point out, in the healthcare sector. It is. I guess it's disturbing that we aren't. We even have to go through this at this point. That we don't have all of them vaccinated. So we will look at mitigation efforts, but at this point we are still, sticking to our November 19th deadline because we have the dilemma of an increased risk of the Delta variant spreading, and much of that related to unvaccinated workers. So it's we are still on our plan to implement as scheduled November 19th.
Thank you. Timothy Jakes, Campbellton Tribune.
Yes, my question's for Dr. Russell. Looking at the COVID dashboard, can you explain or clarify for me data on that dashboard? It shows 100% of persons 75 to 79 have had both doses of the vaccination, and 100% of those 80 to 84 and 85 plus have had at least a single dose. At least 96% in each case, both doses. Those numbers seem high. What does 100% mean in that context? Everyone in the province in that age group, or what is it?
Based on my understanding of that information, my interpretation is the same as yours. Yes, that would be 100% if that's what the numbers are showing.
Thank you, Doctor. Thank you, Mr. Jakes. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, if you test positive for COVID-19 and you're fully vaccinated, are you required to self-isolate for as long as an unvaccinated person? And are COVID-19 positive vaccinated people contagious for significantly less time than a person who's unvaccinated?
Hi, Vicky. So the message is that whatever public health has directed you to do, that's what you need to do with respect to self-isolation. So they are the ones who do the risk assessment based on whether you're a case or whether you're a close contact, including your vaccinations status, et cetera. That's all taken into consideration when they give that public health advice. I know that some people believe that if they had a PCR test and then they had a screening test after a POCT, that would change whether or not they needed to continue to self-isolate. It does not. Your PCR test is the gold standard, and whatever public health tells you to do, that is what you need to do.
Thank you. Bobby G. McKinnon, CBC. Ms. McKinnon? As we wait for Ms. McKinnon, on va aller à Justin Dupuis, l'Acadie Nouvelle.
I'm here. Hello.
Oh. Go ahead, Ms. McKinnon. Can you please speak close to your microphone? Thank you.
Sorry about that. Dr. Russell, what does the latest modeling show for new cases, hospitalizations, ICU admissions, and deaths?
So my understanding right now is that based on the case numbers that we have and the projections are showing that there will potentially be a downward trend. But again, we have to really keep doing what we're doing and manage the situation as we move forward with the public health measures that we're putting in place right now. It is a precarious time with respect to the number of cases and active cases. We could see a shift in either way, and we wouldn't really want that to happen. We're looking for stabilization right now to get us out of this surge and get the numbers of hospitalizations as low as we can in the near future.
Thank you. Justin Dupuis, l'Acadie Nouvelle.
Oui, la question est soit pour M. Higgs ou Dr. Russell. Je voulais savoir si vous savez combien d'employés, que ce soit dans la fonction publique ou les systèmes de santé, les foyers de soins ou les écoles, qui ne seront pas vaccinés avant la date butoir du 19 novembre.
We don't have that stat.
Moi, j'ai pas les numéros disponibles avec moi à ce moment-ci. C'est possible qu'on peut le trouver. Je vais déterminer ça. Je vais demander à notre département de communication si c'est disponible.
Merci, M. Dupuis. Andrew Waugh, Brunswick News. Andrew?
All right, can you hear me now?
Yes, thank you. A little closer to your microphone, please.
Sorry about that.
No worries.
Can you hear me now?
Yes, thank you.
Okay, thanks. So this is either to Premier Higgs or Dr. Russell. I got a copy of an Education Department memo today. I was kind of expecting this to be mentioned, but I didn't hear it. It says that effective tomorrow, that parents will not be able to attend any extracurricular activities or sports activities that their kids are participating in if there's a team involved from a circuit breaker zone. Is that true? And if so, did public health make that decision or did education?
It's too bad Minister Carty wasn't here.
But they encourage everyone to stay.
Yeah. Well, again,
So I think, Andrew, the rules around the traveling outside of the circuit breaker zones is indeed that you don't travel, and that includes that we're talking about being able to play sports within areas that are let's say outside of the circuit breaker zones. So the issue right now is related to that travel from one zone to another, and there is a restriction there that is related to teams and movement. I guess Minister Carty would explain that in more detail, but that is, as I understand it, as well.
Thank you both. Can you repeat that?
Sorry, I'm just trying to clarify. Is this, like it said in the memo, it says that it takes effect tomorrow, which suggests that it's new. Is it new?
Well, not the travel part outside of the zones. That part's not new, but the ability for teams or parents that are vaccinated to be able to watch their kids and to be part of that if they're vaccinated, that part might be new because that is consistent with what we're doing with other teams. But I would, so that would just be aligning with what we're doing for teams outside of schools. But the idea of the movement between the zones, I would say, is still in force. That would be my understanding.
Thank you. Adam Heuris, Brunswick News.
Thanks, Bruce. Question for Premier Higgs. Premier, the federal government announced today that several of the federal government's pandemic supports for individuals and businesses, and this is including the Canada Recovery Benefit, will end later this week. There are some replacement programs costing $7.4 billion and support that'll run until next May. But Christina Freeland still says it's more narrow and more targeted than before. I'm just seeking your reaction and an assessment of what New Brunswickers currently need in your mind in terms of federal pandemic support.
Well, it goes without saying that I'm glad to see the CERB benefit end. We have seen throughout the province, and we've heard from businesses throughout the province, the continual concern that they can't find employees. So CERB has had a negative impact in that case. But I think it's one that's recognized by the Prime Minister because it's something that every one of my colleagues were talking about, and I had this conversation directly with him probably about 2 weeks ago. So that's good. In relation to what the other benefits look like, I mean, I knew the deadline on CERB was pending, but I first read about this just probably a couple hours ago when it was released. So the details of what supports might be required, I don't know yet. We would be interested, and as we did before, if it's federal money that's going through, then it'll go through as prescribed by the federal government into the businesses or into the communities as it's done from the beginning of the pandemic. But I hope to get more details, and then I assume there'd be some assessment criteria that would identify businesses that needed or didn't need support.
Thank you. Savannah Odd, Telegraph Journal.
Can you hear me?
Yes, thank you.
Great. My question's for the Premier. You spoke at length at the start today, asking New Brunswick to trust you, trust your team that's been working on COVID. But over a year into the pandemic, when we dropped COVID measures in July, we had 46 deaths, and now in the past 6 weeks, we've seen 55 more. So, Premier, I guess I just want to ask if you take at least partial responsibility as a government for seeing that death toll double after making that decision, and do you apologize to New Brunswickers for that decision?
Savannah, as Premier of the province, I take responsibility for everything everywhere that relates to the citizens of the province. I obviously deeply regret the situation we're in right now, but I know how hard people worked here to make decisions based on the best information available at the time. We've done that throughout the pandemic, and it's been very successful throughout the pandemic. Unfortunately, the Delta variant has caused us additional challenges that were not anticipated. Our vaccination rates that slowed down dramatically were not anticipated. The situation as we go forward, and knowing that this is not really the end of COVID, no matter how well we come out of this, it's just a way that we have to live with it. Was not anticipated maybe months ago because we hoped we'd seen the end. When vaccines first came out, we hoped we'd seen the end. So, you know, I represent all of the hard work that people have done throughout this province and how many hours, as I mentioned in my talk today, how hard they've worked. And I commend each and every one of them. And we're in a position now to work through this. And I encourage each and every one not to give up. Not be discouraged by the continual discussion about, oh, well, what if we'd done something differently? But to be encouraged by we too can beat this at this time.
Thank you.
Oui, bonjour. Ma question est pour la docteure Russell. J'aimerais savoir, est-ce que vous avez des objectifs à atteindre dans le sud-est et dans le nord-ouest du Nouveau-Brunswick pour lever les mesures coupe-circuit dans 7 jours? Est-ce qu'il y a des objectifs à atteindre en termes de cas actifs, d'hospitalisation, etc.?
Ça va dépendre vraiment en comment la trajectoire va changer, oui ou non, et comment que ça va impacter le nombre de cas qui sont hospitalisés à ce moment-là. Parce qu'on sait, oui, on cherche, on aimerait vraiment voir le nombre de cas actifs baisser. Le plus bas que possible, le plus vite que possible. Mais on sait que ça baisse tranquillement à ce moment-ci. On veut que ça soit un temps stable à ce moment-ci et au niveau des cas qui sont hospitalisés dans les soins intensifs. Alors, le plus bas le nombre de cas qui sont hospitalisés qu'on peut atteindre dans les prochains jours et semaines, c'est ça qu'on va regarder et c'est ça qui va déterminer les prochaines étapes.
Merci à vous deux. Monsieur Derek Dubé, TVA. On va passer maintenant à Monsieur Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour, est-ce que vous m'entendez?
Oui, plus fort, s'il vous plaît.
Oui, m'entendez-vous?
Oui, merci.
Oui, désolé, technologie. Ma question est pour le Dr Russell. C'est pour revenir avec la question là, de mon collègue anglophone au sujet là, des activités parascolaires ou des activités, des sports intérieurs et extérieurs. Aucun spectateur n'est alloué. On a eu une autre clarification au cours de la journée disant que les zones, là, les parties entre zones sanitaires peuvent se permettre, même s'ils sont dans les zones de coupe-circuit, mais dans les zones de coupe-circuit, on n'a pas le droit de spectateurs, mais dans un autre cas, si un enfant joue U13, comme Bantam, on peut avoir des spectateurs, mais du côté d'interscolaire, on ne peut pas. Est-ce que c'est une question qui revient du ministère de l'Éducation ou la santé publique a été avisée par rapport à ceci?
Allô, Alexandre. Je crois que c'est vraiment une question qui devrait vraiment être répondue par le département de l'éducation à ce moment-ci, parce qu'il y a de la clarification, je crois, qui devrait être faite. On veut que ça soit tout aligné avec les recommandations pour la communauté, comme les équipes de sport.
Merci, docteur. Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour. Ma question est pour le Premier ministre. Le gouvernement fédéral avait promis 10 milliards de dollars aux provinces pour développer un passeport vaccinal. Est-ce que vous allez utiliser cet argent-là ou une autre source de financement pour donner de l'aide financière aux entreprises comme les restaurants et les salles de spectacle qui doivent mettre en application les mesures de santé publique, comme la preuve de vaccination?
We are working with the federal government for a national passport guide, and I said we will be in a position to have that completed by mid-November. And yes, I would say we would be taking advantage of the money that the federal government has offered and supplementing that as required. But we want a national program, passport system in place so that it is consistent across Canada.
Mais est-ce qu'il y a de cet argent-là qui va être acheminé aux entreprises pour les aider à mettre en application ces mesures-là?
At this time, I don't know the details of how it's dispersed from the federal government, but given what we've seen in the past, I would guess that criteria would be part of developing this code and administering. But I don't know to this point how the federal program is going to work. But I just know the offer was made to your point of the dollars, and usually it comes with criteria, and we will certainly follow that criteria.
Merci. François Leblanc, Radio-Canada.
Oui, allô?
Oui, plus fort, Monsieur Leblanc, s'il vous plaît.
Pas de problème là. Est-ce que c'est mieux?
Un peu.
OK. J'aimerais revenir sur les questions qui ont eu lieu sur le sport scolaire, parce que je pense que vous ne comprenez peut-être pas l'enjeu. C'est qu'il y a eu un cafouillage à l'Association sportive interscolaire du Nouveau-Brunswick. Hier, en après-midi, ils ont envoyé un mémo à toutes les équipes qui annonçaient qu'on permettait les voyages entre les équipes des zones qui sont affectées par le coupe-circuit et celles qui ne le sont pas. Donc, Moncton peut aller jouer à Caraquette, par exemple, pour tout le sport, dans le sport scolaire. Sauf que on disait que maintenant, plus aucun sport pouvait avoir de spectateurs, ce qui a suscité beaucoup de colère chez les parents. 24 heures après, l'association a fait marche arrière en disant que ces interdictions de spectateurs-là étaient seulement pour les équipes, les matchs où il y avait une des deux équipes qui venait des zones coupe-circuit. Donc, pourquoi ce cafouillage? Pourquoi il y a eu des changements? Et puis, pourquoi il y a 2 poids, 2 mesures? Parce que à 16 heures, à Caraquette, il peut y avoir un match interscolaire où il n'y aurait pas de spectateurs. Et à 18 heures, le match de hockey mineur, il pourrait y avoir des spectateurs parce que pour entrer dans l'aréna, ça prend un passeport vaccinal que les gens ont. Pourquoi il y a 2 poids, 2 mesures entre le sport scolaire et le sport civil, donc qui n'est pas rattaché au sport? Les parents sont vraiment en colère, puis je dois vous dire que vous êtes peut-être en train de les perdre là, présentement. Donc, est-ce que vous pourriez être plus précis quand vous répondez là, à cette question-là? Merci.
Certainly, you are very correct. There was a standard that was different for outside school activities than inside, and that is being corrected. So what we're going to do here is send the information out so that it'll be clear. And what our goal is here is to harmonize what we're asking for outside school to be the same as activities that were inside school, and that will be corrected. It is now being corrected. So you'll get that. We'll send that. We'll commit to send you the update and clarify those because there's been 3 questions on it, and I think that's the best way to because it was very, very recently discussed, and it was determined that we should have a protocol that's similar for school activities and certainly outside activities. Merci.
Merci, M. Leblanc.
Êtes-vous en train de dire qu'il n'y a plus que les matchs de hockey mineur ou de sport mineur vont être soumis aux mêmes règles? Ça veut dire que les parents pourront pas assister au match?
M. Leblanc, le premier ministre a répondu à la question. On va maintenant, s'il vous plaît, passer à ton collègue, M. Jérémy Tessier-Vignon.
Bonjour, vous m'entendez bien?
Oui, M. Tessier-Vignon.
Oui, j'aimerais savoir si c'était possible d'avoir des statistiques concernant l'éclosion de cas dans la résidence Le Marais de Dieppe. Combien d'employés ont été touchés, combien de résidents ont contracté le COVID et qu'est-ce qui est fait pour que le foyer puisse continuer ses activités, ses soins dans un environnement sécuritaire. Donc, une situation un peu plus précise, mais on aimerait savoir des données sur ce qui se passe dans ce foyer de soins-là.
Du Marais.
Oh,
Oui.
Résidence du Marais.
Oui.
OK, bonjour. Alors, dans la résidence du Marais, à Dieppe, les infections, il y a 5 résidents et 1 employé qui sont infectés. Et je sais que ils ont fait des dépistages dans cette résidence. Ça a été fait 4 fois. Et en total, il y avait 37 cas et 4 décès. Alors, à ce moment-ci, je sais, comme toutes les situations dans les foyers de soins et les résidences à long terme, c'est toujours avec l'aide de nos équipes promptes qui leur aident à gérer la situation.
Merci, M. Tessier-Vignon. Dr. Russell, Tom Bateman, Brunswick News.
Hi there. A question for Premier Higgs about the isolation rules for unvaccinated travelers entering New Brunswick. My understanding is that the province's enforcement system right now relies on the honor system in the sense that it's up to each and every unvaccinated traveler to declare themselves as such on their registration form, which would then prompt more in-person contact from public safety officers. Why is the program designed this way? And Mr. Premier, are you confident that the system is indeed ensuring unvaccinated travelers are isolating, as per medical advice? Thank you.
The honor system is really part of, I guess, a long-term ability for us to manage COVID. We won't be able to catch or contact every case. We aren't at the borders like we were back at the beginning or throughout the pandemic up until, let's say, last spring. But that's not inconsistent with what we're seeing in other jurisdictions. We do require pre-registration, and we are seeing that the hot zones, it's quite readily evident that in the hot zones we have a low vaccination rate, and that is accelerating our issues in terms of being able to manage that. But fortunately, we are seeing the circuit breaker in these areas have an impact. So at this stage, we believe that managing those areas and getting our vaccination rates up and asking people to register, and we do spot checks at the borders, is sufficient. However, having said all that, we've asked specifically of public health if we should review anything further at this point. And so we will determine and analyze that over the coming weeks, and a lot will depend on certainly what we see for stabilization of current counts and dropping of hospitalizations, and that'll be our guide.
Thank you both. Erica Butler, CHMA.
Oh, hi there. This is for Dr. Russell. I wonder if you can talk a bit about what makes an outbreak in the fourth wave and what the protocol is for both declaring one and declaring one over. It seems to have changed a bit since the first few waves, and so now I'm not sure I understand what the term outbreak means.
Hi, Erica. So with each outbreak, it is actually usually the medical officer of health that is managing the situation that declares the outbreak. I don't have all the details with me other than to say that it depends on whether there's transmission within the facility. So somebody could have a case. So you've heard in other ways, somebody could have a case and we would declare an outbreak just based on that. And then we would be doing testing of the facility and things like that. My understanding now with whichever medical officer is involved in managing the case, it's around whether there's transmission within the facility.
Okay, and to declare one over?
Again, I just got some more details on that, and it's really around reflecting the status of vaccination of the population. So previously, when our nursing homes were unvaccinated, the chances of onward transmission and severe outcomes were much higher. So again, how things have changed in terms of that definition is really on the basis of the fact that our population is more widely vaccinated.
Thank you. Tim Roselle, Global.
Thank you, Bruce. My question is for Premier Higgs. Premier Higgs, can you update the status of contract negotiations with CUPE? And can you also outline what contingency plans are in place in the event of a strike?
Well, certainly, it's this has been quite a balancing act as we try to juggle the issues around dealing with COVID and the hospitalizations, and what that means as the different networks are in red, and then the possibility of a strike. I personally find it kind of unconscionable that strike situation would be pending, given what we're dealing with on the health side. Nonetheless, we've seen the information that's been released today and relating to strike preparation. We have proposed to CUPE a wage settlement that is in keeping with certainly what the province is able to manage, and I reiterate that any benefits that we've seen to date, that of our financial situation is directly related to one-time federal payments. The other situations, we've also did a comparative analysis of what is being offered and what's in relation to benefits that are currently there versus outside sectors. And so we feel we're being more than fair in the process. We've also added to this, that we'd go on casuals, say 80%, we would go to 100% pay for casuals. We offered that we're going to look at salary comparatives and where we're out of sync in these key areas. Healthcare would be one. We'd look at how we deal with that. So we have a very, fair position, one that represents fairness to taxpayers and to employees. Unfortunately, CUPE has maintained a position throughout that it's 5% a year, 20% increase across all locals in their jurisdiction or bust. So we've also indicated that, we would talk with each local in relation to, we could talk overall of the wage package, but each local in relation to some of the issues that are more pertinent to them that we want to address, so it doesn't bog everybody down. So we put options on the table. Our resolve is strong because, as you know, I'm always one looking out for the long haul. It's not about my time here in office. It's about the next number of years, the next generation, the future of our province. And we know how that is being challenged every day, not only in COVID, but in so many other ways, and how we must do things differently. So, COVID has caused us to do things differently. And I guess if we are faced with a strike in COVID, then we will be forced to do things differently to cope. Unfortunate situation to be in, but we'll do what's necessary to protect the citizens of our province.
Thank you both. Aidan Cox, CBC.
Thank you. This question is for either Premier Higgs or Dr. Russell. I heard from a concerned citizen who says that 2 home care workers who provide care to her mother are unvaccinated and that even though their salary is subsidized by the Department of Social Development, they're not going to be required to get vaccinated as they work directly for a private company. I just wanted to first off ask if in fact home care workers such as those are not part of the province's vaccine mandate for provincial workers, and if so, why not?
Well, actually, it's my understanding they are included as part of our overall mandate because if it's anywhere that we are subsidizing that healthcare program, then it usually it'll fall onto our obligation. Now, having said that, we're asking employers that are subsidizing healthcare workers as their company to enforce the rules and to ensure their employees are vaccinated. So our position is clear in what's required, and it would be our position that we would intend that those companies would indeed find a way to get their people vaccinated or an alternative way to supply the service that's being rendered.
Thank you.
Are there any companies in that realm that would be able to sort of get away from having to require their employees get vaccinated?
At this point, I'm not aware of any. There could be some circumstances, but at this point, I'm not aware of them.
Thank you both. Monsieur Alex Villeneuve, Radio-Canada. Monsieur Villeneuve. Merci, mesdames et messieurs. Merci aux membres de la média. Voilà la fin de notre mise à jour. Merci beaucoup. Thank you to members of the media and everyone for joining us for today's update. This concludes it. Thank you.